with the Comeback Team podcast. Today we've got a different concept. If you've been anywhere near me as a spine health practitioner, you've heard me talk about prehabilitation. Most of you, fortunately, have not. Prehabilitation is really a potent concept that we started implementing into how we took care of people with spine health injuries about 15 years ago, and physical therapy practices around the world are slowly adopting it as a concept. But what does that mean? What is it to the average community member? What is it to people as they live their daily lives? Prehabilitation is pretty much what it represents, the concept of rehabilitation, but doing it in advance. And it goes back to fundamental things we all grow up with, that we all understand about the value of preparation, the value of purpose, the value of preventative maintenance, regardless of what it is we're talking about. The number one most important question I want to start this podcast with to our community is, where are you personally, physically, emotionally for the next time you get hurt?
Right.
Are you in a good place? Just pause, reflect, ask yourself that question. Are you ready for your next injury and all that it's going to bring you? Because we're all going to get hurt. And I think with that, we'll start this. And so what is prehab? What is it to you guys?
Well, for me, in being in a sports environment, first of all, to your point, the number one predictor of future injury is what? Previous injury. Right? So are you prepared, knowing what you know about your body and that it may ultimately break down one day? Are you prepared? What always fascinated me was seeing the athlete that experienced, say, a torn ACL, and they come back from a torn ACL jumping 5-6 inches higher and running a tenth of a second faster than before they got injured. And you ask yourself, why is this? Why is the guy who gets Tommy John surgery come back throwing 2-3 miles an hour faster than before he got injured? Why? Well, the big reason is because when they come out, they spend time with people like Frank and people like Chuck, and they work on their physical aspects of their body, actually of the mechanics, and then they put it into dynamic action with Chuck and the biomechanics, and then they come see me for performance. The reason why they're doing that is because all of the stuff they did in rehab after they got hurt was just as valuable before they got hurt, which could have very well prevented them from getting hurt in the first place, which prompted me to believe over the last several years, last 10, 12 years of my career, like, if we know this to be true, then why don't we start to incorporate aspects of rehabilitation in the before process, hence prehabilitation, to A, prevent them from getting to a bad place, or B, help maximize the performance that we're looking for.
And it's something that comes up in rehab more and more. And Robert and I started that about 6-7 years ago when we started working together. How can we perfect the outcome? And we can perfect the outcome if we go in the process earlier on. If we have people come in and they know they're going to have a surgery or they're still dealing with an injury, how can we get them to that point where they go through that process of re-injury or to the process of surgery and then land on the other side, land on their feet running and be able to take off immediately. Right. And it's not only something that is proven in the medical literature and scientific literature, but it's something that we experience with our patients, that they do so much better when they have that, not only physical preparation, but especially the mental and the emotional preparation. We discussed that a little bit in our last episode, in order to prepare themselves to have a better outcome.
I'm sorry, Chuck. Just since he's on the medical thing, I want to finish one aspect to the community at large. Everybody in the community, either you personally or someone you care about, is going to go through an orthopedic procedure of some sort, whether it's a spine surgery or shoulder, hip, knee, ankle. But at the end of the day, they're going to be in one of three general classifications. They're going to be highly functional with an acute injury that's taken them out of their game, whatever it is. They're going to be middle of the road, borderline functional, and then they've got a decent starting point for their prehabilitation/rehab. Or three, they're going to be at the end of a very long road because they were injured a long time ago and they've gone into this deep, dark slide. Ironically, as a surgeon, most of us see people after the deep, dark slide. And so when he talks about the program we do for prehab, the goal is to get people more ready for surgery, because really the hardest time to succeed from a surgery or to succeed from a recovery from a surgery of orthopedics or spine nature is when you're massively deconditioned, when you're down in the dumps, you're deeply dark emotionally, you feel vulnerable, you feel weak, you can't ambulate, you can't move, you can't navigate. And so we try to prepare people. The worst time to learn that, if you're in a deep dark slide, is immediately after you wake up from anesthesia. Now you're in anesthetics, you're on narcotics, and you don't have the strength and power to do it. So it's valuable even in the surgical episode. The one thing, I want to get back to, and I'll transition to you, Chuck, is, this not only includes sports, this is for life, this is for career, this is for, whatever your family pillar, we all have pillars in our life, and prehab speaks to all of that.
What's interesting is chronic injury is usually not, the site of the injury is not the problem, but that's what is typically focused on. Right. A patient comes to you with a chronic injury, you're focusing because you're trying to make them feel better. So you have to focus on that for a moment, but you're unusual from the majority of docs that I've worked with, is that you look at things globally as well. And the site of the injury typically is not the problem. It's a joint level above or below, maybe 2 levels above or below that are limited in motion, and then the compensation occurs over time. When I look at prehab, and I believe, Robert, you mentioned this earlier, is really a lifelong pursuit. Prehab, if we're going about it properly, is making sure that what I call the big movement rocks is, and I mentioned this earlier, but the foot and ankle complex, the hips and thoracic spine, if they're moving properly, we're not going to see as many chronic injuries. The back is a prime example. It's stuck between the hips and the thoracic spine, and nearly 100% of the people that I have worked with that have a back problem, there is a foot and ankle, hip, or thoracic spine issue going on, and they're limited in motion. So if they're getting ready for either surgery, and Frank and I have talked about this many times, and as you, Frank, stated earlier, the literature supports that you go in strong, you'll come out strong, you'll be ahead of the curve. The way I look at prehab is also what we talked about earlier, TA, and movement prep in an earlier episode. Yeah. If we look at movement prep and in certain regards prehab, they're not that much different.
Correct.
And they kind of mirror or run parallel with each other.
And they need to, because those two things are not mutually exclusive. They are included with one another. And I think what we were just discussing earlier, speaking on a different topic, was part of this is about lack of information, and part of it is about misinformation, right? Some people are getting the wrong information. Right. For instance, when we want to be able to move functionally in a sound manner, some joints are mobile, some joints are stable, right? Where we really run into trouble is when we start stabilizing mobile joints and then asking for movement out of the stable joints. Next thing you know, you're subject to some kind of herniated disc or something happening. If you stabilize thoracic spine and try to mobilize through the lumbar spine, then we can really be in trouble. So having the right information on how to move appropriately when you're training, when you're exercising, and how to get out of pain first. Oftentimes, to your point, John, getting out of pain has to do with understanding how to move the right way, and we want them to have the right information, right, Frank?
And speaking of misinformation, that's something that we see a lot in our professional lives, is that people get the information to shut down completely. If they have an injury, don't do anything. Just sit down, lay down, don't engage in any activity, which means that you get deconditioned more and more and more, and that gets you to the deep dark slide where at a certain point you're not able to do anything anymore.
Yeah. As a spine surgeon who's worked for 30 years, that's one of the most frustrating, shocking, and learned things that I hear every single day from my people that have come from far, far away is, what have you been doing? Oh, everybody shut me down. Everybody told me don't do this, you might get hurt. And it's very anti-negative. Obviously, we don't want to encourage participation in activities that are going to make your injury worse or put you at risk. But that brings up the whole concept of adaptive fitness, adaptive performance, adaptive rehab. And you got to keep going. If you don't keep going, every part of you will start receding, not just the injured part. And we can protect the injured part with intelligent, smart physical performance, treatment, stretching, flexibility. profiles.
Movement is medicine, right? So like literally, movement is medicine. Like motion is lotion, right?
Right.
So movement being the medicine. I heard a story about early part of the century or late 1800s, early 1900s, where the physician would come to the house and make the house visits, right? And they would come with this bladder full of, junk or whatever it was. They had something that made the bladder heavy. And they said, here you go. I know you're sick. I know you're hurting. Lift this up over your head, put it back on the ground, turn it to the side, bring it back to the middle. This became known as a medicine ball, right? Because medicine, the movement, the engaging in activity, light levels of resistance training, and getting your body to engage and getting your nervous system to engage, that was the medicine. So they called this a medicine ball. And I think that if we take this medicine ball mentality now, and we realize it's really the movement, not the narcotics, not the prescription drugs, not all of these different things that they're asking us to ingest. Not saying that you never need any of those things, but what I am saying is if you make movement in your foundation, you're going to find a whole new level of health and wellness that you might not have otherwise been able to achieve without it.
You use a great example of the medicine ball. I mean, all muscles, all joints work in 3 planes of motion, and so many fitness programs, so many articles on fitness, so many rehab programs just work in 1 plane of motion, and that's where we become limited.
And stay limited.
And stay limited, absolutely. But if we understand that we have to work, and the stable mobile concept, there's not mobility, there's not stability, there's a blend of the two. And what's interesting, when you do have patients or clients that have to be immobilized, I mean, when you've done, I don't want to get to a surgical aspect, but you've done surgeries and patients have had to be immobilized in that region for a bit, I've often talked to you and said, what if we leave this area alone, but we just mobilize and get them moving in other regions that won't create rotation and stress on that injured site? And you said, no problem, go ahead and do it, as long as we're cognizant of it. Mm-hmm. And in rehab, we've done the same thing. Correct. That patient has had greater outcomes. So I don't want to say that in the fitness world that machines are necessarily bad, weight machines are bad, but they have a role. Mm-hmm. There's a limitation though. Sure. And we at some point need to look at that. How do we use it? But make sure we get people moving in all 3 planes of motion.
Yeah, and
from the proper regions as well.
Correct. And in addition to just moving in a multiplanar fashion, it is once you put something on some rails and you guide the trajectory and path of the resistance like you would in a traditional machine, cable machine or something like that, the challenge that you have is that you don't get engaged with the proprioception. Right, with the balancing mechanisms, with the small little stabilizing muscles in the joints that are moving through a range of motion, the variable resistance that's created, inside the joint capsules and so forth. So if we can start to help people understand how moving freely through a range of motion can help really be the medicine that they're looking for to start their comeback, everything starts with motion. One more thing I was going to say is our brain's primary function, as we know, is about movement, about motion, not about thinking. Thinking is a positive byproduct. So our ability to move is what makes our brains sharp. It's why we're the most, why we're at the top of the food chain. So if we can continue to engage some of those neuromuscular patterns and firing patterns and so forth, we're really starting to create a whole new life for people that have been sedentary for some time. And then maybe they don't have to go the path of surgery because we've just gotten them moving in a more appropriate fashion.
What most people don't realize when they get an injury is that injury can become one of 2 things. It can become just an episode in their life that they overcome and exit from, or it can become a disease process. Wow. They have everything to do with the eventuality of that answer. Mm-hmm. And if you treat it like it's a permanent problem that's going to limit your global self, it's a disease. Wow. If you treat it proactively, intelligently, structurally, careful, and you resume human performance, human function, adaptive fitness, adaptive flexibility, motion, it's not a disease. It's a physical liability. It's a physical reality. It's still there. Oftentimes you can recover from it. Sometimes you can't. But it's not a disease state. You still function. And what is the definition of disease? It has to do with your human performance, your human practical relevance, your state of ability. And we all want to be able-bodied. And you can have, we see examples of that. You brought up in the last podcast, the Wounded Warrior Program. And I know so many of those people from my little journey in the Navy in the 80s. And you see people without limbs, you see people who are paralyzed, have full, meaningful lives.
Absolutely.
They don't see themselves diseased. And so give yourself a chance when you have these injuries, to the community. Make sure that you have the power to say, look, I'm going to get through this, and I'm not going to shut down. I'm just going to be careful and smart.
The injury and the disease does not define you.
Correct.
I think that's the most important part.
The one point I want to make, I agree 100% with what you were saying earlier, TA. But having people hear that, it's good tonic for them to have, but we have to make sure that they go about it properly and find where their successes of movement are. I mean, we move forward and back, side to side in rotation, but we need to progress them, or if they're going to be taking the initiative on their own, find where they're successful and most comfortable first, and then we need to progress it from there.
Well, as we get into deeper levels of actual physical movement and performance, there's no question we'll talk about passive versus active, and all movement isn't created equal. As you guys articulate that, it's valuable to our community, but you can do passive movement even in a fusion environment around a joint if it's done within certain limits and or within pain boundaries. I mean, there's so many artificial, arbitrary start and stop points to movement, and how aggressively you move, and how much torque, and how much explosiveness, and that's where your expertise on it is so critical to doing it well towards performance. But people sometimes have too much of an all or nothing approach to injury. And what you really need is a professional team counseling you towards positive recovery goals with best of class evidence-based medicine. And when you have that with confidence, you can sustain a physical platform that's going to keep you functional. And all movement is not created equal, and so at the end of the day, this prehab concept starts and stops with preparation, and the value of identifying your goals, and based on who you want to be in your future, you have to have a certain fundamental preparation to fulfill that goal strategically. And we all see it in our domains. The people that show up strong, that's been our hashtag for years. We've all shared it. The people that show up strong do the best. They do the best in performance. They do the best in surgery recovery. They do the best in injury recovery. They do the best in preventing the need to having surgery. So many people who show up strong don't end up needing spine surgery. Whereas the weakest, most vulnerable typically are too deep. They miss that window of opportunity to avoid surgery. And so it's priceless to prepare yourself for the potential injury that we're all going to have. And some of us have more than others, and I know that from experience. But all in all, I think the next several podcasts are going to start to really build on these last 5, because now we're going to get into the nitty-gritty of the details and how to transition that person. Okay, I'm mentally prepared. Okay, I've got a plan. Okay, I've looked at my own personal strengths and weaknesses. I've got a map. I've got eyes forward. Pretty soon we're going to be aiming towards that. And anyway, thank you. This is the Comeback Team podcast, and check us out on social media as we get into the value of your next step in this journey towards your best self forward.